So we're here at the Heart Hospital.
My name's Safi Haq. I'm one of the cardiovascular and thoracic surgeons here at Lourdes and at the Lourdes Heart Hospital.
So how long have you been working here?
This is my third year here now.
You like it?
I love it. Yeah.
Do you feel like our food brings you a lot of extra patients?
You know, I think you could probably say that. I think there is quite a bit of coronary artery disease here. Some of it probably can be attributed to some environmental factors.
Yeah, I grew up eating rice and gravy, so I'm just hoping mine hangs on.
We're going to focus a little bit on some things that pertain to women more so.
A little bit different in what we experience when our heart breaks.
Yeah, absolutely. That's one way to put it. When you look at heart disease, though, women do experience symptoms in a slightly different way in some instances. The main things that we're worried about with patients experiencing with heart disease are things like chest pain, getting short of breath, feeling winded or tired easily, having leg swelling and things like that. Unique things about patients that are women, especially diabetic women, are that they can have heart disease and it presents in an atypical way. So they may not necessarily have any chest pain, or they may have feelings that feel like indigestion, and that may be an indicator of heart disease. So those are all things we kind of have to keep in mind.
Women, we've got these different symptoms. We don't want to always compare ourselves to the textbook that we're seeing. What's a good way to take care of our hearts?
The best things that we can do are to mitigate some of the environmental risk factors that cause heart disease, like smoking. You had mentioned food, so we make heart healthy diet choices, try to stay away from processed foods and refined sugars and things like that, and just, in my mind, I say just everything in moderation. And then there's the obvious things like stopping smoking, regular cardiovascular exercise or aerobic exercise. Things like that can really help out. Also, one thing that you can't really get away from is your family history. So that's something that you should really kind of, if nothing else, just be aware of and realize the importance of it when you're, interacting with medical professionals.
Is there anything red flag where you really need to sit down and be like, well, wait a minute? Like if you could pinpoint one thing that somebody's come up to you.
I think, like you said, all of us have long days and we all tend to get tired sometimes. But if this is becoming like a recurring theme, or if people around you are noticing, sometimes the way that I put it is, if you enjoy doing something all day long and then you start noticing it takes you all day long to get those things done, that's usually an indicator.
It's actually really helpful advice, like a different kind of tired.
Yeah, absolutely.
How trustworthy, because I know a lot of us have it, we have a Fitbit or an Apple Watch. Sometimes it pings me and it's like, hey, your heart rate's really high. You should worry about that. Is that accurate? Should we be paying attention to that? Or is technology kind of when it comes to our hearts?
I think we're fortunate to live in the time that we do, and we have all these technological resources at our fingertips. I think all of those tools that we have are really kind of alerts or alarms. The Apple Watch isn't going to tell you what the problem is. It's going to tell you something that's abnormal that you might not otherwise think twice about and just go about your day, but that you should be paying attention to. So if your heart rate's fast continuously, repeatedly throughout the day, multiple times, you may have a rhythm issue or something like that. So those are things that we should pay attention to. I wouldn't, make all your medical decision making based on those things, but we're lucky to have them, and I do think we should pay attention to.
That's some really good advice for women. We go through a lot, so it's nice to have a little handbook.
That's right, y'all do go through a lot.
You could think of one thing that you see amongst all your patients if you would have just not done this one thing.
I think the biggest thing as we age is to recognize when your body's telling you something, and recognize that it may be abnormal and may need to get looked into. The feeling of, or the attitude, the sentiment that something's going to buff out as we age is really something that we should put to the side. We can't chalk everything up to old age and, getting heavier and things like that. And we're lucky if we find out that that's truly all that it was related to, is just a little bit of aging or whatever. But if there is a problem that needs to be addressed, I think that in the day and age that we live in, we have to take preemptive measures. And if we have tools available to us where we can kind of figure those things out before something really bad happens, I think that behooves all of us, and it kind of helps us live longer, happier lives.
So don't put it off. Don't argue yourself out of it.
Exactly. Don't try to convince yourself that there's not a problem.